Good afternoon. This is Judith Bendersky at the Washington Sheba program, and we're going to go through a slide deck and talk about person-centered Medicare counseling, integrating the no wrong door approach to Medicare advising. This may or may not be a topic that's new to you, whether you're a new Sheba volunteer advisor or you've been advising and counseling clients on Medicare for years. Hopefully everybody that attends the webinar will pick up some new idea or something that they can apply to their practice. What we'll cover is what exactly is the no wrong door system and where does that terminology come from? What is a person-centered approach and how does person-centered Medicare counseling work? We'll review briefly your role as a Sheba advisor, some effective communication skills, and the process for INA or INR, information and assistance, or information and referral. We'll talk a little bit about how to focus conversations to make them most productive for purposes of coming to some resolution or plan for moving forward with our Medicare clients, and cultural sensitivity. Initially, I watched a presentation and read a presentation similar to this in the field of information and referral. And later on, with the permission of NASUAD and the INR training from the organization called AIRS, I was able to adapt it to Medicare counseling. The purpose is so that we can utilize best practices used in the no wrong door access system and fuse that with both the art and the science of Medicare advising. And that is so that regardless of what service provider a Medicare client accesses, whether it's a community service office or it's home and community-based services, or even at a healthcare, in the healthcare setting, that we're all using the same sort of approach, which is called the no wrong door system. And the no wrong door access system is touted throughout the country as a consistent way to approach people. And it can be people with developmental disabilities, people that are aging, and just people in general. So even law practices are using the no wrong door access system. It's a system which really honors and respects the individual and them as the center of the conversation and their life and their life's goals as the center from which they make options. So the Sheba program, or the SHIP program nationwide, is one of many aging programs funded through the Older Americans Act, and that is similar to the national program called Meals on Wheels or Congregate Meals, caregiver support, and community living connections. And there's many others, including eligibility reviews for Medicaid and caregiver support. So the no wrong door approach is that we help people connect to the right resources at the right time, including helping them access other services or referring them to other services that is supportive, and doing all this in a manner that is quite seamless. It's about ensuring that someone and that our clients are at the center of the decisions which relate to their life. In a person-centered approach, we actively listen, we think together, we coach them, we share ideas, and we seek their feedback. So how does this relate to Sheba's mission? Well, what we do in our role as Sheba advisors is we listen to people and we clarify our understanding of what people are saying, and then we help them move forward. And we do that through cultivating partnerships and community service and volunteerism. So, you know, with Sheba, we are all trained to be confidential, to provide free and unbiased information about Medicare, and often it spills over into Medicaid, and sometimes it spills over into the Affordable Care Act and Social Security and Apple Health and lots of other things. We offer counseling on topics that we have the capacity to answer questions about, Our very busy time during open enrollment. We help people with Medicare supplements. We help them understand the difference between Medicare Advantage or receiving Medicare through original or traditional Medicare. As we do that, it's quite obvious that we're talking to people who are 65 and older, people with various disabling conditions, people with end-stage renal disease or Lou Gehrig's disease. And what that means is we're talking to people who are in a transition. They're turning 65, or they may be experiencing some of the challenges of aging. They may be experiencing mental illness. They may be extremely frustrated about letters that they've gotten in the mail or ads that they've seen on television. They may be experiencing a hard of hearing or deafness or limited vision or being blind. They may be experiencing living in pain or a whole range of things that are culturally, linguistically, and medically really not something that we're even aware of. So for that reason, it's important to be very clear and to speak as accurately and precisely as we can. Some of the techniques for effective communication include actively listening, paraphrasing, reflecting on what people have told us, hearing them emotionally. Sometimes we ask a lot of open-ended questions. Other times we really have a guided conversation. We may pause. We may express empathy. We may help them prioritize and say, you know, you've told me quite a long story. Let me help you unpack that, and let's make a plan of these 3 or 4 different things that you've talked about, and let me help you remain organized, but I need your partnership in organizing this information so that you can move forward and I can move forward in the things that we can do. Other people that we serve and other groups that we serve, aside from the beneficiaries, immediately could be their family members, their caregivers, powers of attorney that may live far away. For all we know, we don't always know who's in the picture, and other people that are acting on behalf of a Medicare beneficiary. It could be at a nursing home, it could be a social worker. So let's talk a little bit about some of these communication techniques. With active listening, we're listening, we're letting people talk, and we're extracting, as we do that, the facts that we think are going to be pertinent to their Medicare situation. If we're speaking over the phone, it's a good idea to just pay attention to what they're saying and take some notes. Maybe we have a STARS record open and we're just taking notes into STARS. Or maybe we've got a Word document open and we're jotting down some of the things that they say. Or maybe we have a pad of paper and we're sitting down with them and we're maintaining eye contact with them, but we're also taking some notes. There's lots of different ways to actively listen, but focusing on them is really important and what they're saying. Minimal encouragers are nonverbal and sometimes verbal cues where we might say, I see, oh, okay, all right, I gotcha. So that while they're speaking, they can know that we're still listening. Paraphrasing is when we take their story and we rephrase it, focusing on the pertinent points as it relates to Medicare. Sometimes when we're rephrasing, we're also educating, and maybe somebody describes a lot of money that they had to pay out of pocket, but as we're paraphrasing, we're using the term deductible or cost sharing. So to the second point, paraphrasing back to a client allows him to hear their story and to know that they're heard, but it allows us to translate into accurate Medicare terms what they've told us, and also to clarify our understanding of the situation. Sometimes in the process of paraphrasing, people feel invited to respond again or re-explain something, and so that's okay. We may then be paraphrasing back a second time. Reflecting and emotional labeling, these are techniques where we're reflecting back to what a person is saying, letting the client know that we understand their emotions. So it's different from paraphrasing, which really looks at the content of what they've told us. Reflection and emotional labeling is more like when we say, you sound very overwhelmed with this, and I hear that I hear that you're overwhelmed. This is a very frustrating situation. You might think that it's really easy to turn 65 and make this transition, but there's a lot of choices that you're confronted with. So I hear you. I hear you, or I feel your pain, or I understand what you're saying. So it validates their feelings. Open-ended questions are questions that cannot be answered with a yes or no. So an open-ended question might be, so tell me how that Medigap policy has been working for you. Or have you had a conversation or thought through whether you may want a Medicare Advantage plan or Medigap? And tell me a little bit about that. So it gives us a chance to get to know the client. Closed conversation, on the other hand, or a non-open-ended question requires a yes or no. So, did you pay the bill? Did you pay that bill? That's a yes or no question. Although we don't always get a yes or no answer, sometimes I say to people, so this is a yes or no. Did you pay $422.69? And that sort of prompts them to say either yes or no. Pausing can be very effective. It can allow the overwhelmed or the client that you're sitting with to gather their thoughts, or to maybe take a pen in hand and mark on a piece of paper and expand something that they really meant to cover. Pauses should not last for too long, but it's good sometimes to just say, I'm going to just stop for a moment, or to just pause. Empathy is the ability to look at a person's situation and try to understand how you would feel in their circumstances. Like the expression says, something about, I cannot walk a mile in your shoes. We don't know what people experience, but we can be empathetic and explain to people that we are trying to understand how they feel. And then prioritizing is something that we can help people do, and it's the ability to listen to a client and then narrow down the steps that need to be taken, or prioritizing what the most urgent thing is first. So it may be that a person has a big mess with Medicare and Medicaid and Social Security, and they got disenrolled from something, and it could be that the very first thing that they really need to do is contact Social Security with an updated address, because nothing is going to sort out until that is sorted out. So just sometimes helping people understand that there are 2 or 3 or 4 or more things that need to happen, and helping them wrap their heads around the fact that there are quite a lot of things that need to be done, and helping them prioritize and helping them make a plan. Guiding is sometimes encouraging people to discuss in more full detail what their concern is. Guiding is when people get off topic, bringing them back and saying something like, I'd like to go back to what you were talking about with that $127 a month. Can you tell me more about your spouse that got on Medicaid, and just bringing them back and helping them focus. regarding tone and speed, when speaking to clients, it's it's helpful if you match their tone and their speed. That is not to be confused with matching them if they're really angry and being angry back, or if they're screaming at you, screaming back. But if people are thinking through and speaking slowly, it's going to help them in their processing of what you tell them if you can match approximately their speed. Now, that's not easy. Some people speak much faster and think faster than I can. I cannot speed myself up to match their speed, but it's worth giving that a try and keeping that in the back of your mind. And then simplicity is the art in Medicare of educating people about the correct terminology without overwhelming them and giving them a thesaurus. So if somebody talks about their Medicare paperwork or their statements, that's okay. In the process, though, you can let them know we call that the Medicare summary notice. Or if people talk about my prescription coverage, you can say, well, we call that Part D, or Part D as in drugs. And so that way we're using correct Medicare language, we're educating them, but we're also listening to the language that they use and sometimes using that, because for the purposes of their call, maybe they just need help with something and they're really not interested in learning or changing their vocabulary. We want to avoid, when we're speaking with clients, behaviors such as threatening or commanding them, or personalizing their solution or lecturing them. Now, we all have our spiels, so to speak, that we develop over time when we explain what a Medicare supplement is or how a Medicare Advantage plan may be geographically oriented. But we don't want to get to the point where we're giving a lecture. So these are just things that we avoid. Because in the Sheba program we're providing unbiased information, we don't want to make decisions for people. We want to let people decide for themselves, but give them enough information and not so much information so that they can make a decision for themselves. Cultural sensitivity. So as an advisor, as a Sheba advisor, you may speak to people who refer to themselves as he, him, or she, her. People may describe themselves in a variety of ways that may be new to you or may be common and something that you're very familiar with. You may speak to people with accents, people with English as a second or third or fourth language. You may meet people who wear a hijab, and that may be a new experience for you. You may run into any variety of cultural, unique things that are new to you. It doesn't matter, of course. People are people. And in our role as Sheba advisors, what we really want help people to understand is what their choices are that they're facing moving forward. It certainly is helpful to know, for instance, if you're talking to a group of people from, let's say, Laos, and they're older and they came to the United States recently, it's certainly helpful to be mindful of the fact that they probably don't have a conceptual framework for health insurance as it is in the United States, with premiums and deductibles and copays or networks, out-of-network providers or in-network providers. This is possibly completely out of the realm of their experience. So it's certainly a gift to them to listen carefully to what they're saying and try to provide information that's helpful to them without making any assumptions about what they may already know or have experience with. In terms of linguistics, if people speak a language that you do not speak, or any language, you should feel free to use the language link. It's really a lot of fun to learn to speak to somebody through an interpreter. It takes longer because you're speaking, the interpreter is then translating or interpreting, the client is then speaking back, and the interpreter is then speaking to you. So the whole process takes 2 or 3 times as long, and it does require a lot of patience. But it's a lot of fun, and it's a great feeling when you've completed a conversation with a client through Language Link or Language Line. I forget which it's called. This says Language Link. Now, there are phases in the world of information and referral, and those of you who are INR or INA trained or work for a AAA that does the Community Living Connections or the Aging and Disability Resource Network, you're perhaps familiar with this, but there's a sort of life cycle, if you will, of a client contact. And this is true whether you're a librarian working in a public library, or whether you are a greeter in a hospital, or whether you answer the phone for a child care center, or whether you do Medicare counseling. And the steps, roughly, are welcome. Step 2 is assessment. Step 3 is clarification. Step 4 is information giving. Step 5 is referral or assistance giving, if that's appropriate. And step 6 is closure. Now, in many information and referral organizations, closure also includes, or there's another step, which is called follow-up. And some SHIVA sponsors do follow-up, where they routinely call a client 6 weeks or 8 weeks later after the initial contact and say something like, Mrs. Smith, you contacted us back in early October. You had some questions about Medicare, and here we are 4 weeks later or 6 weeks later, and I'm giving you a call back to see how everything has gone. Have you followed up and found out which Medicare Advantage plans your favorite healthcare providers take? Or did you make the call and sign up for the Part D plan? Or is there something that you'd like to go over with me? And so that's called follow-up, and that's another phase. Now, these steps don't always go in order. Sometimes people call and they launch right into clarification, and you launch right into information giving. But typically, you touch these areas in some way during the life cycle of your relationship with that client. So in the welcome phase, you want to be supportive and empathetic and warm because it's the very beginning of building a rapport and trust with the client. And so you certainly want to be nice in the beginning. You want to be nice throughout, but you want to be friendly, otherwise they're not going to want to really visit with you, come in face-to-face, or talk on the phone. In the assessment phase, you're determining why they called or why they came in and what their needs are. And what the client expresses that their needs are really may be quite different from what they really need help with. But you're there to listen and assess and try to extricate from what they say and apply that to how you may be able to help them. And so, you certainly want to listen to them and assess them, but you may need to talk with, continue that conversation. And that would be in the form of clarification. Understanding, expressing your understanding of what they've said, paraphrasing, reflecting, and making sure you understand what they want assistance with. And this is when you provide the bulk of your actual counseling or advising. When you actually show them documents and say, well, there's two paths to Medicare, or here's the prescription drug list. There's 7 plans, or maybe it's 8 plans that provide full extra help. We call those the benchmark plans. This is maybe where you're looking and you're pointing to the Medicare summary notice and you're saying, well, Medicare, your doctor charged this much, but Medicare allows this much. 80% is this much, so you're actually doing the information giving. Or you've got the plan finder opened up in front of them during an open enrollment clinic, and you're pointing to the screen. So we tend to think that this is all that we do, but all those preliminary steps prior to and the follow-up steps afterwards really make up the whole session. And sometimes all they need is some information. Other times they need information, and then you refer them. Maybe you say, you're going to really need to go and talk to the CSO office down the street because it looks like you submitted an application, but you lost the letter that asked you to recertify. Or I'd like to refer you to the Washington Prescription Assistance Foundation because clearly there's no other alternative for you through Medicare to get Genumet, and that's very expensive. And I'd like to give you a phone number and ask that you make that call and let them help you with that. Or, we've talked about Medigap, and now the step for you to take is to complete the application that we've just printed off the web. We do have a document on MyShiba with their plan, and I don't remember exactly what that's called, but it's an action plan where you can step out for them what they need to do. And sometimes, as I mentioned, you'll be referring people to other offices. It could be that there's something that they need to do. Maybe they need to red flag their account with 1-800-Medicare because they get all their meds from the Veterans Administration and they don't want to get auto-enrolled again, and you can't seem to use your unique ID and they need to call 1-800-Medicare, or maybe they need to call Social Security. Closure is when you're finishing the conversation, you're wrapping it up, or you're trying to wrap it up, and let them know your contact information for follow-up, and you're closing this, the conversation. Whether you could or could not resolve their issue, at a certain point you need to close it and let them know with your body language and with your words that you've done what you can do. And some other tips around person-centered Medicare advising is that you're empowering them, you're educating them. You're assisting them and supporting them, and to the degree that people need assistance support, we want to be able to give it to them. For a lot of people turning 65 and going just sort of birthing into Medicare, all they need is being pointed in the right direction and some empowerment. Maybe they can already use the web. Maybe they can use the plan finder. That's fine. When you're talking to people that are considerably frail and elderly or frustrated, or have other challenges, then you want to maybe support them and assist them more than empower them. You want to empower them with your assistance. So, we appreciate in the SHIBA program that we have to be flexible, and we appreciate very much that you as volunteer advisors and in-kind agency advisors are helping people to the degree that they need help and to the degree that you can help them. If somebody really sounds interested, hey, they may be a great volunteer. If they seem to have done so much homework that they know, as much as you do, or they've really challenged you to look some things up, that's great. Suggest to them that they could be a really great SHIBA volunteer. And refer them to your volunteer coordinator, or send them an application, or have them come on in and just see what SHIBA's all about. And as usual, let's remind people that we're here, the Office of the Insurance Commissioner is here for all their insurance needs and not just SHIBA. And that ends this webinar, although I didn't mean to completely cut off the PowerPoint. But this ends the webinar. Thank you very much for your attendance. And contact me. My name's Judith Bendersky, and if you want to call me, my line directly is 360-725-7107. And my email address is judithb, as in boy, @oic.wa.gov. Thank you again for attending this webinar. Bye-bye.